one to the 11th annual Love Your Heart. We're virtual once again this year, but just as excited and enthusiastic as ever. Today, we celebrate the kickoff for Love Your Heart's Week of Action in San Diego County and throughout our binational region. Last year, I touched on how our lives have changed in so many ways since the onset of the global pandemic just 12 months prior. Now here we are, 24 months later, and still nimble and proactive in our response to both the pandemic and its links to heart disease. Yes, not even COVID-19 can derail our important and collective life-saving efforts toward heart health. The numbers, the data, continue to tell us the stories of both great strides and work still to be done. Heart disease tragically remains the leading cause of death in the United States and the second leading cause of death in our county. Locally, more than 4,000 of our family, friends, and neighbors die each year of coronary heart disease or stroke. Love Your Heart has a simple mission. Reduce those numbers by helping residents protect their hearts by knowing their blood pressure numbers. I am so proud to be able to say that through campaigns like Love Your Heart and related efforts, we have made a real difference. Tens of thousands of San Diegans have participated over the years, and we annually hear of people who make appointments with their doctor and get their treatment after getting their results. Our mission is to keep this momentum going while working in concert with COVID limitations. Last year, we piloted providing tools and strategies directly to individuals and families so they could be the best stewards of their own heart health. This year, we are adding even more. Strong partnerships, both regionally and binationally, through Ama Tu Corazon, remain key to building on the great progress already made. For details on this year's Love Your Heart Week of Action, I'm pleased to turn it over to our lineup of amazing and committed guest speakers. And to begin, I'm happy to introduce San Diego County Board of Supervisors Chair Nathan Fletcher.
Thank you so much, Nick, and thank you to our entire Health and Human Services team for your commitment and your daily work to ensure that San Diegans can truly live well, thrive, and prosper and go and really have a fulfilled life. Since first joining the Board of Supervisors, I've been very pleased to champion Love Your Heart, now in its 11th year, an incredible program that has had such an impact. I'm proud to join in to do my part. You know, we want to provide each and every one of us, each and every San Diegan, with the opportunity to know your number, to know the condition and status of your heart, and to know if maybe there's a problem that you were unaware of. This month, we know, is a perfect time not only to express your love to those you care about as we head into Valentine's Day, but also to encourage everyone to ensure that they care for their own heart as well. Together, we can raise awareness, we can provide options to treatment, we can save lives, and we can help ensure not only future generations, but the better quality of life for all San Diegans. The impact of pre-existing heart disease has really come to the forefront in a very significant way during COVID. We have seen that individuals who are the sickest with COVID-19 tend to have underlying health issues, with the most prevalent being hypertension and high blood pressure. Untreated high blood pressure exacerbates the effects of COVID-19 and has proved incredibly deadly. 43% of this county's COVID deaths have hypertension as an underlying health condition. This is especially true for those who live in areas of San Diego County with historic health disparity. Recognizing this, last year we created a special Love Your Heart partnership with our community health workers, with our local clinics, and with partners who serve communities that have been hit hardest by the pandemic. We have provided and infused additional resources, at-home blood pressure monitors for families and individuals. And this year, as we come into 2022, that strategy continues with some exciting new additions. Select San Diego County library locations will have blood pressure monitors to be used on site, and takeaway educational materials for folks to take to their home. We have partnered with Aetna CVS Health to offer blood pressure screenings at multiple CVS locations. And not to be forgotten, our longtime Love Your Heart partner, Northgate Gonzalez Markets, will offer screenings in San Diego County and at other locations throughout San Diego County. Speaking of Love Your Heart's reach beyond county borders, the Ama Tu Corazon Health Awareness Campaign in Mexico has been an incredible partner of this effort, and led by our county's very own Barbara Jimenez. It has grown to include partners on both sides of the border. To share more, I am pleased to introduce one of our dear partners and trusted friends, Dr. Maria Gudila Rangel, the Executive Secretary of the U.S.-Mexico Border Health Commission, Mexico Station. And before we hear from Dr. Rangel, let's briefly turn our attention to a special Love Your Heart video presentation.
Just don't move and relax.
Hypertension or high blood pressure is known as a silent killer, claiming the lives of over 4,000 San Diegans annually.
Perfect. Hypertension is asymptomatic for most people, so you don't even know you have it. Most people find out in the doctor's offices. Nice to see you, as always.
The older you get, the greater chances you will develop high blood pressure. Race is important as a risk factor, as well as family history. And also, if you are physically inactive, or if you're overweight, or if you utilize tobacco, smoke.
And we know that African Americans have the highest rate of hypertension than any other ethnic group in the United States. And because it leads to so many other chronic conditions, it's really important that you take charge of it as soon as you know about it.
High blood pressure can lead to a stroke or a heart attack and is the #1 underlying condition associated with COVID-19 deaths.
This is so that you and your family can take your blood pressure at home and know your numbers and tell your doctor your numbers every visit.
With in-person doctor's visits limited during the pandemic, the county teamed up with community organizations, businesses, and healthcare providers like San Ysidro Health to get blood pressure monitors into people's homes.
It's wonderful to have this. Yeah, thank you. I really appreciate it.
We were able to get them into the households, 1,000 households, giving these people blood pressure monitors to take with them to their households, empowered them to be the ambassadors for their health.
Well, I have to check my blood pressure every day because sometimes the pressure is too low or too high.
It's very important for me to have a blood pressure monitor at home because I have a husband with a heart problem. This is really going to help us.
Because we are starting to see hypertension in younger populations now, it's never too early to start monitoring your blood pressure.
The more informed you are, the more you can help your doctor best manage your health.
And help you love your heart.
Thank you. Bye-bye.
Muy buenos días a todos ustedes. Bueno, pues yo soy Gudelia Rangel, secretaria ejecutiva de la sección mexicana de la Comisión de Salud Fronteriza México-Estados Unidos. Y el día de hoy es un placer para mí estar con todos ustedes por esta colaboración de otro año más de la campaña Ama tu Corazón, en la que hemos estado colaborando desde el 2015. Este es el 7º año en que la Comisión colabora con la Agencia de Salud y Servicios Humanos del Condado de San Diego para realizar esta campaña binacional. Primero empezamos en Tijuana en 2015 y a partir del 2016 se sumaron los otros 5 estados de la frontera norte de México. También comentarles que las 14 ventanillas de salud que tenemos ubicadas en los consulados de México en el sur de los Estados Unidos han participado por varios años en esta campaña y este año las 14 ventanillas y creo que otras ventanillas no del sur de los Estados Unidos, sino de otros consulados de México que tenemos en otros estados, participarán en esta campaña binacional. Nos unimos como región para combatir la principal causa de muerte en México y en Estados Unidos. Y sabemos que la educación y la sensibilización sobre la salud del corazón a nivel binacional es muy importante. El año pasado en México se realizaron 22,766 mediciones durante la campaña Ama tu Corazón. Esperamos que este año podamos hacer mucho más detecciones y que también podamos instalar mucho más módulos que el año pasado. Sabemos que el COVID, pues desde los sistemas de salud se han tenido que redireccionar recursos de otros programas para poder trabajar en la pandemia a nivel mundial. Sin embargo, el COVID también como impacto ha ocasionado que nuestra población, que ya era una población vulnerable, una población con diabetes, una población hipertensa, con otras enfermedades. Ahora, con COVID, se ha hecho una población más vulnerable y requerimos de los esfuerzos de todos los que estamos aquí y los que se sumen para seguir trabajando binacionalmente en la prevención de enfermedades cardiovasculares. Quiero invitar a todos nuestros connacionales y a todos los que nos escuchan que acudan a medirse la presión para cuidar la salud de su corazón. Me voy a permitir ahora introducir al doctor Rafael Amezcua. Él es director médico de Aetna Better Health of California.
Muchísimas gracias. Thank you very much. Rafael Amezcua, I'm CMO for Aetna Better Health of California. I'd like to start off though that for the full year of 2021, CVS Health administered more than 32 million COVID-19 tests and more than 59 million vaccines nationwide, including the area of San Diego. During the COVID pandemic, many people have delayed their annual checkups. So these screenings are a way to help get back on track. CVS Health is a long-standing supporter of the American Heart Association. As the presenting sponsor of Go Red for Women since 2017, CVS Health is joining the American Heart Association to help advocate for research and education about women's heart health, to help address inequities related to healthcare access and maternal health disparities. As we continue to see cardiovascular disease as the #1 killer of women annually, it is so important for all women to understand the disease and take charge of their heart health. The majority of cardiac events can be prevented, yet most women don't have the awareness about this disease to understand and prevent the risk. Heart disease and strokes can affect women at any age. According to the American Heart Association, research shows younger generations of women in communities of color, Generation Z and millennials, are less likely to be aware of the greatest health threat, including knowing the warning signs of heart attacks and strokes. This is precisely why it's so important for all women to take charge of their heart health and encourage others to do the same. It is now my pleasure to introduce the chair of the board for the San Diego American Heart Association, Julie Moran. Thank you.
Thank you. I'm Julie Moran, the American Heart Association San Diego Division Chair-elect. I'm a strategy partner for Deloitte in our life sciences practice and the office managing partner here in San Diego. I thank you for the opportunity to speak this morning. As you know, we're very excited about the work that we collaboratively accomplished via the Love Your Heart initiative. 1 in 3 American adults, about 80 million people, have high blood pressure. And that number is unfortunately steadily climbing. The proportions and statistics and numbers are very similar in San Diego. The American Heart Association is focused on ensuring that people reach their full potential for a long and healthy life. As a leading risk factor for cardiovascular disease, uncontrolled high blood pressure has the potential to derail the progress made fighting heart disease. Uncontrolled high blood pressure robs us of precious time with our loved ones. It's a silent killer that causes unnecessarily and inequitable disease and death. Collaboratively with Love Your Heart, we're positioned to empower the public to take control of their heart health, know their blood pressure numbers, and to know what those numbers mean. Ideally, this helps people to better control their blood pressure and results in more quality time with their loved ones. Together, through these collaborations, we're creating a healthier San Diego. We are making an impact. I'd like to thank everyone for bringing us together today, and I'll turn it over to Chair Fletcher.
Thank you, Julie, and a special thank you to the American Heart Association for the work you do day in and day out, and the real commitment you have. And to both of our doctors we heard from, we appreciate you tremendously and appreciate your partnership. I also want to thank a couple other folks, Champions for Health, AMR, San Diego Blood Bank, also really engaged and involved in this, and we appreciate each of you and your work as well. Speaking of the blood bank, I want to take a moment to hit another topic that's of important issue. You may have heard there is a national shortage of blood, and San Diego County is certainly not immune for that. And so we encourage you all, step up, donate some blood if you're able. Each blood donation comes with a health screening as well. We check your blood pressure, so it's another way you can know your number and help out as well. I think we all know folks that have been impacted by heart disease, and the numbers show we are either one of those impacted or they are in our circle of friends and family and coworkers and people we love. So as we get ready to celebrate Valentine's Day, let's take the moment to encourage everyone to love your heart and know your number. And so thank you for everyone for joining us today. With that, we're happy to open it up for any questions if there are. And if not, we want to wish everyone a happy Friday, and hope you all enjoy the rest of this nice, warm Arizona day we're experiencing here in San Diego. And thank you again to all of our partners and everyone involved for joining us for this event. Thank you all very, very much.